Good morning, everybody, and welcome to this first of 3 joint webinars from Health Education England and the Council of Deans for Health. Today, we will be concentrating on a strategic overview on advanced practice. I'm Cassie Haig. I'm Principal Lecturer and Programme Lead at the University of Cumbria, and I'm the Chair of APPE UK. I'm also a member of the HE and Council of Deans Advanced Practice Group. I'd like to welcome everybody to this session today, and it's very, very interactive. So please use the webinar chat that's on the right of your screen to communicate with each other and use for the question and answer sessions. This webinar is being recorded for those people who can't attend, and it will be shared after the event. Now, we need you to have your phones handy for later on. When we've had a short break after we've heard from Beverley, we will be asking you to put some thoughts, questions onto Slido. And there will be a QR code on the side of the bar that will be put in that you'll be able to connect to. So without further ado, I'd like to welcome Beverley Harden, who is the National AHP Lead and Deputy CHAPO, Multi-Professional and Advanced Consultant Practice Lead from Health Education England. She's a visiting professor at the University of Winchester and has recently been awarded an MBE. And Bev's going to give us a strategic overview on advanced practice. So over to you, Bev.
Wonderful. Kathy, thank you so much. Thank you so much indeed. And I want to start, as always, just with an incredibly huge thank you to everybody, because the work that is being done around advancing practice is, as I've said so many times before, some of the most complex and challenging work we've ever done. And because it is so complex and so challenging, and it has become everybody's solution to everything, which is, although lovely, is part of our challenges, I would suggest, is that it is only by the nature of us all working in absolute partnership with the shared purpose of serving our population to the best of our ability with the skills that we bring as the different, unique and valued healthcare professionals that we are. But it is about us working in partnership to think, to problem solve, to understand how we implement, to learn fast. And if we make mistakes, support each other to learn from those mistakes and to change and to move on with the work that we're doing, and to continue to work towards that shared purpose of driving down health inequality by liberating the full workforce to the benefit of the population. And also to ensure that we are giving people like all of us self-actualizing careers that enable us to stay in clinical practice, offering the best of ourselves to the people that we serve. And I have very few regrets in my clinical career. My regret is that I had to leave my clinical role. And the last thing I did in clinical practice when I left my clinical role and my clinical managerial role was to create the consultant practice role that I would have loved to have had for myself, and that I would love to have been able to have stayed in for my career, delivering my clinical skill to the population that I served. Instead, we move on, the next generation comes forward and drives the future brilliantly for us. But that shouldn't be the case. There should be jobs for people like me, people like you, delivering the brilliance of our clinical care throughout the whole spectrum of our career opportunity. So absolutely driven by reducing health inequality, making sure the care is absolutely the best it can be, and making sure that there are self-actualizing careers. So we retain our talented clinicians in clinical roles, delivering clinical care to patients. And this agenda, I completely and utterly understand and respect, is incredibly challenging, very emotive and tricky for all of us. And I think we need to be really honest about that. And I think that's how we stay in the space of curiosity and shared problem solving and learning. And across our whole population, there's probably a third of us who think, fantastic, the work the centre is doing is wonderful, brilliant, not before time, brilliant. There's a third of us that think, oh my gosh, if a passing crocodile could eat that Centre for Advancing Practice, it wouldn't be too soon. And then a third of us in the middle who think, I'm watchfully waiting, this is interesting, we'll see which way it goes and see how, at what point I choose to be, more involved in the work that happens. And I respect that entirely. But it is that spectrum of consideration that is so important to us. The thing that scares me most is when we all stand together in violent agreement, because we need diversity of opinion. We need different perspectives. We need people who say, yeah, Beverley, that sounds interesting, but no, let's just stop and think about that, because if we tried X, Y, and Z, things could work better. And when we can have those conversations around different approaches, different ways of thinking, we get to better solutions. So you have been a really generous, very engaged community. You have helped us by coming forwards and saying, not sure about that, let's talk about it. But the spirit of engagement, the spirit of driving forwards, and the spirit of wanting to make sure that every profession has the ability to be noticed for the uniqueness that it brings and the shared skills that we share is such an important part of our work. So my New Year's wish for 2023 is that we continue together in relentless curiosity, relentless, compassionate, caring, collaborative working that doesn't shy from the difficult conversations and drives us forward with solutions so that we are able to think, to learn, to continuously improve the work that we do. So really interested as we move into this year. We have a year 2023, and Health Education England will merge with NHS England and create our new NHS England in April. Very exciting. Fantastic that it brings together the clinical commissioning developments, the workforce, into more strategic harmony. We've always worked brilliantly together, but this brings us into one place and enables us to absolutely drive as one into the future. So very, very positive, very, very exciting. It will create a slight hiccup around the point we merge, because things always take a little bit of a moment just to resettle, but it will not impact on the nature of the work that we do. It will just take a different form and we'll have a different organizational title. You've all been there many times before, you know the drill. Other things that happen though in 2023 is that we will publish at some point in the first half of 2023 the workforce strategy for England, which will be a collaborative workforce strategy, absolutely informed by the systems. And the key and the clear activity around all of the NHS reform work currently is that system is king. The systems will be determining the future of health and care to ensure that we are informed by the reality and the need of service, of populations, of places and people. Brilliant, perfect, fantastic. Challenging though, because those systems are at a level of different maturity, they are moving into their space, they are understanding their remit, they're getting their people organised. And so we're at a stage over 2023 while the systems are moving into their space, getting their operating models established, that we need to continue to move and drive and educate and support whilst the systems are learning their craft. Some are beautifully maturing and doing some incredibly brilliant work. Others are at a much earlier stage of their development. Our job in the roles that we have as universities is to wrap around those systems, wrap around our nursing, allied health, science, pharmacy, and other professions, structures that are beginning to emerge, or at least the leaders in those structures, to make sure that we have a shared voice around the opportunity of advancing practice within the context of emerging systems as they start to get a real handle on their workforce pressures. And the workforce strategy will start to talk in terms of numbers and of change to the workforce, of the evolution of professions, but also the real magic of the advancing practice agenda in offering different workforce solutions. We've always said this is not medical substitution. This is modern teams liberating the benefits of all the professions, being able to deliver for patients. So the long-term plan will absolutely continue to harvest the work that we have started together. The beauty of the last year is that we have published the enhancing practice work. Alison Leary has worked tirelessly with us to help us to get to a point where we have got the enhancing practice website has gone live this week. There's work happening around beginning to really understand in certain aspects of our world what enhanced practice would really look like. And as you know from the work we've talked about before, the enhancing practice agenda is a professional agenda in its first understanding. It is about growing us up as a professional that we are, learning our specialty, learning what it means to be us in the context of team, in the context of modern healthcare, but learning to be the skilled professionals that we are, and learning to really value the shared skills that we have too, so that we are creating strong, confident, capable professions who are able to really understand their USP and function in the multitude of different roles required across the country in the best of their ability. For me, Beverley, the physiotherapist, as a physio that I am, delivering physiotherapy, perhaps in a broader role, but I'm still there as a proud physiotherapist. So system is king. Workforce strategy will start to talk in terms of expansion, evolution, and advanced practice is the solution for so many different clinical areas that a lot of the work we are doing is working with those programs to say we need to be mindful about the system readiness, the governance, the supervisory constructs available in those specialties, the people available to step into these roles, and the work that has been done to develop people, which is why in the enhanced practice work becomes so important, because actually it is the enhanced practice workforce who are our mainstay. And if we are developing, supporting them optimally, we then have got the perfect foundations for advanced practice and to enable people to step up and beyond into advanced practice roles. So we've really got to think about how, as universities across the system, there is a thought to how do we create the stratification of education and training development that drives workforce transformation. So we've got the enhanced, the advanced, and the consultant practice continuum whereby we can build. It isn't about fast tracking people so fast that there is a meteoric rise in people's career aspiration, pay banding, and levels of responsibility. We know we need to craft professionals over time to really ensure that we enable their skills to mature and for them to step into their place as the clinicians that they are. So I'm really excited about how the workforce strategy starts to set out the stratification and enables us then to work together collegiately. And the professional programs will drive a lot of the enhanced practice work. A system pressure for more specialty specific training, which is really quite interesting because for our more senior clinicians, clearly doing enhanced level practice in frailty or mental health, whatever, absolutely perfect. But for when you think about enhanced practice into the future, people will be doing their education training earlier at that stage that we would have wanted in the days of that EMB programs, etc. For nursing. There was a lovely stratification of education and training. But as people start to do their enhanced training earlier, we need to be really clear that this is about bringing strong clinical professional understanding into the mix. So there's a real setting down process for us in the enhanced practice space. I'll come back to advanced practice. But again, the long-term workforce strategy will talk about consultant practice, very much positioning it as the huge retention strategy, huge workforce transformation opportunity about driving different leadership across systems and different approaches to thinking through how we can deliver 21st century care to drive down health inequalities. And one of the most beautiful pieces of work that I think that we have managed to do together is the fact that the consultant practice pilot was first established within learning disabilities and autism. When you think of the huge opportunity for advanced and consultant practice within transformation across learning disabilities and autism services, when you think of the changes and the challenges that they have faced over the last 10 years or so and the reports that we've seen come through, to see Rob Crouch, Kim Manley and the team deliver with Sarah Goodhue, who is our regional faculty lead for the consultant practice work, to see that delivered with our learning disability mental health team is quite beautiful, and to see what we can do and to drive in that space with plans moving into cancer and imaging and MSK into the future, again, driven by service priorities through systems and through long-term plan policy. So a huge amount of work happening around enhanced, advanced and consultant practice. If we move into the advanced practice space, which is clearly what we are primarily here to talk through, is that the long-term plan will start to really move the conversation into this is not CPD as a part of just developing your learning over time. This work is fundamental workforce transformation. This is about driving, as we've said right from the beginning, the transferable, recognizable qualifications that enable people to really start to drive and build on their scope of practice. Alongside the workforce strategy, a second document will be published this year, which is going to be a refresh of the Framework 15 document that you will find on the HE website, which set years ago the vision for the next 15 years worth of of how the workforce will be. What is the mechanism? And I would suggest that when this document is published, that it would be top reading material, because it is going to refresh for people that real underpinning of how, as healthcare professionals, we are progressing and need to pay attention to the different and the emerging facets of being a professional. And when I say that, it's about it. There's nothing in that Framework 15 document I would suggest that we don't know already. This is not about new, exciting, different things. It's about how we are positioning healthcare practitioners for the future. And as you know, my biggest fear is a sludge workforce. I want to see a beautifully defined, respected workforce that enables the professions to play to their capabilities. But there is a real emphasis on not just defining ourselves about what makes us different, but proudly defining ourselves about what makes us the same. Sorry, I've got a doorbell ringing, and I have a son doing an exam upstairs, so I'm going to have to ignore the doorbell, however excitable they get. So we've got to think about how we define ourselves on the basis of our unique skills and our shared skills, understand the overlap between where that sits at the different levels of practice, and be proud to consider both aspects of that. Because the Framework 15 document will really start to major in understanding where we share skills and capabilities, where we are having unique skills, and how we work together in modern teams to really deliver and develop that synergy across the two aspects of how we work. And that is so exciting on the basis of the fact that we see the recognition of the bits that make us unique. The risk would be that we would see the value put on the bits that we share, not the bits of which we are unique. But we are getting that real understanding of the fact that we are a product of both of those parts. So the Framework 15 document also then starts to really talk through, again, raising the bar on moving towards a more preventative healthcare model, really grappling with health inequalities and really working in the space of population health, understanding how we work with people to prevent and to really understand the impact of health and social care challenges on health inequalities. That should be the underpinning of so much of how we then think through how we are preparing this advanced practice workforce for the future, because they are the clinical leaders that are not only delivering the clinical care, but will be the clinical leaders, the thought leaders around how services develop over time and how we really start to think about driving fundamental change in how we run healthcare services. Thinking towards the consultant space, where again, where that consultant level system leadership is absolutely fundamental to driving different ways of working. So quite not a reframing, a refresh of the thinking about how we be as clinicians. And alongside this work in the advanced practice strategic space, Michael Guthrie, who works with us in the centre as our policy lead, will be running a piece of work over the next few months to look at how we refresh aspects of, and I've deliberately used the word aspects of, the framework for advanced practice. This is not about messing with the innards of it, because we've got so many things established around the key areas of capability. So please don't worry. But this is about refreshing our positioning of the advanced practice piece to make sure that our language is modern, that our language is relevant. And the magic of what Michael and the team have been doing with our policy leads is working very collegiately with colleagues in the 4 nations to ensure that we are having a 4-nation conversation about advanced practice. And as you know, we've talked about that many times before, but the magic of having an advanced practice conversation across the 4 nations is that, let's face it, we happily worked together. And I happily, when we did the work back in 2017, we worked from the documents that colleagues had done. We referenced the documents that colleagues had done in the other countries, that we all have the same principle here. There's nothing new here. So to have a statement that holds us together across the 4 nations would be exceptionally fabulous, to give us the ability to have that connectivity. So what we'll do in the first instance is refresh the framework with our phraseology to make sure that we are current. We will review the content of it to make sure that there is nothing that's either out of place or out of date. We'll work with 4 nation colleagues to have an overarching umbrella. And then we will start to work far closer with 4 nation colleagues to learn from each other and to collaborate together, so that particularly where we have smaller, more niche areas, we are able to perhaps work together more collegiately than we have achieved today. We've all been eyes down trying to sort out our country perspectives, but it was joyful to meet together with Four Nation multi-professional colleagues, and just to feel the fact that we all got to a stage where we felt we could really now raise the game on our connectivity. The other key thing clearly happening in advanced practice currently, and Julian represented me at a meeting with the NMC yesterday, is that we have the NMC activity around looking at what does regulation mean in the space of advanced practice, which is fantastic. Working very, very closely with colleagues in the NMC, and it's fantastic to see the thoughtful and really interested way that they are grappling with this work. And so no idea what the outcome will be, but I have total faith that they will do absolute due diligence on coming to a point of understanding what is right and proper. And we've been very clear with the NMC that we are only in this space because we had to hold the quality assurance of the huge amounts of public money that we put into this space, and we had to create the connectivity of policy with system and with education providers, which is exactly what we do. So very, very, very interested to watch the NMC. We're working with the other regulators, though, with the clear request, please, that wherever possible, we move as one, so we do not end up with a fragmented or fractured system of different regulation across different professions. So very clear, and Michael's been incredibly brilliant in driving so much of that work, connectivity across regulators and connectivity across the professions. So I'm hugely grateful for that. And that then gives us the opportunity to, again, underpin our work across Four Nations with our regulators working with us. So very, very, very good to see how we have been able to continue to work together, challenge, support, understand together, and hugely grateful for that, that support. So in the Centre for Advancing Practice, you will have seen the first year was very much focused on course accreditation. Natalie and the team have done the most incredible work in moving course accreditation on. I've got some figures here that I'll hunt out for you and just give you some update on the work that Natalie and the team have done. They've got 92 programs accredited from 35 different education providers. 20 more programs are in progress with 38 more booked. So we hope we bring you the 100 figure today, but we're not quite there yet, but it is absolutely motoring. And again, enormous thanks to everybody's pragmatism, support, help. I appreciate it's been difficult for people. I appreciate it is more work at a busy time. But when we come to the point of trying to achieve the objective of standardizing the understanding in the system of advanced practice, understanding how people can transfer and move their qualifications around the system so that people can then confidently start to establish new ways of working with workforce that is nationally recognized and able to then move around the country and move into roles without having to always reprove yourself. That's not English, is it? But, you know, prove yourself again that you are good enough in the work that you do. So huge amounts of work happening around reaccreditation, and your quality monitoring is now in place. So things really starting to then move into a place of this becoming a regular understanding of how we operate, with apprenticeships being part of the self-declaration. So we're trying to be as pragmatic and as proportionate as possible, bearing in mind that if regulation comes in, this increases the responsibility of what we're doing. So there's no fast pass here. This needs to be understood in the context of what the regulators, again, would be needing to think through, depending clearly on the level of regulation determined. Digital badges have been launched. Oh my goodness me, it's like giving birth to a baby porcupine, or a rather large porcupine. It was a hugely challenging piece of work to get the digital badges mobilised, and Eloise and the team with Julian have been exceptional based on the work that Richard started to really get digital badges to a place where they are a thing. And again, the huge governance that sits behind that to make sure that this is a understood, proportionate and pragmatic thing. And again, huge thanks to our reviewers, many of whom are on the call today, I have no doubt, who've driven fundamental work for us in getting credentials endorsed, programs endorsed, all the work that they do brilliantly to help us. And we've got 54 of you in the space, and hugely grateful for that. So fantastic work to a team that works so hard and get through so much work. It's wonderful. The general program work across the centre, Julian clearly has led the centre for us for a while now, which has just been absolutely wonderful. Is that the progress we've made around the work with the centre, for me, was absolutely brought to a head with the launch of the International Journal for Advancing Practice. That has been a dream that we have been trying to achieve for years with Joy Conway and the team. It has been so complicated, but to see it pop out as a thing is just overwhelmingly exciting. So again, a desire to really drive and build and support your students and your alumni in getting their work published, disseminated, really truly understood, and start to drive and build the evidence base for advancing practice. And again, if colleagues have got ideas about how we could work quite differently in supporting some of your research colleagues to really think through how we start to amass some really clever thinking around building the evidence base, the return on investment, the health economic argument, the real facets of advancing practice, we want to talk to you about how we can really drive, with Joy when she's back, a real understanding of a program of research work that's going to start to answer the questions that everybody's asking about. This is all very lovely, but does it return investment? Does it start to drive down health inequalities? Is it the retention strategy that you are presenting at Beverley? So we do really want to work far more with you in that research space, as well as in the academic and education space. The portfolios, year 2 was about, really starting to drive the portfolio piece. And again, I cannot thank you all enough for your Herculean work in standing alongside us to work with employers to ensure that people who employers believed were working at advanced practice level, who did have transferable currency, were enabled to bring their work forwards, to have that level of governance oversight, to enable people to show a level of equivalence with the programme. Not a two-tier system, just different manifestations, and showing respect to people who are already working at that level. That's been really challenging work, because for a lot of those people, the last thing in the world they want to do is have to prove again that they are good enough. And I absolutely respect that. And there is no mandate to do it, but I do understand that employers are now actively seeking this. And we've got about 1,500 people moving through the system. Appreciate it's difficult. The challenge is, what else do you do that sets a common standard that allows people, particularly with regulation potentially on the horizon, be in that space? So I know that Julian, Annabella and the team have worked so hard with individuals to support them to really land this with our university colleagues in the most pragmatic and intelligent places, yet still holding the standard on quality, because we have a duty, if we are offering a digital badge, to be clear, the governance of that must be the same. So again, apologies for colleagues for whom this has been a challenging process, but it is the mainstay of trying to move this agenda forwards so that we don't have to keep proving ourselves again. And I appreciate totally the challenge that has for many people. Working with some of the professional bodies who already have programs in place for accreditation, this is really difficult work because everybody does things slightly differently. And again, the whole point of this is to achieve a level of pragmatic standardization. So a lot of that work remains ongoing, and we have to commission very clear governed pieces of work to do due discipline on what we are doing with each of the different professions. And we've got work starting with the Royal Pharmaceutical Society, which will be the first piece of work that really does start in that space, and conversations with many other professional organisations who are active in the space of recognising advanced level practice. So huge amounts happening through the programme. Eloise and the team are working incredibly hard. Amazing conference that you remember. And then the facet of the work for 2023 has been about thinking about credentials. Before I talk about credentials, one of the key pieces of work that has gone through all of our years of activity, which James Pratt brought to a crescendo for us last year, was the work on governance. And I have to say, complete respect to the work that James did with us and for us, is that I've never seen a piece of work which was quite so challenging land so well in an environment hungry for that governance framework to work with. So that was a really beautiful piece of co-production led by service, meaningful to service, about how we support. And again, I know none of this is easy, but it was just so nice to be able to have the foundations of governance in place. And when you look at work that people are doing across the regions, work that's happening around the extending surgical teamwork, there's so much activity here driving the advanced practice opportunity. It is the governance that lets us down. My regional faculty leads, who are doing the most incredible work with regions, are very, very, very clear that the challenge is that we have got a real gap often, as you will see constantly, in the ability for organisations to have that governance in place, and for us to support and help really understand how best we can support people to establish the governance that the organisations need, the supervisory work that's needed. And now having Debs Harding working with us too in the centre for the next year, wonderful to be able to then work with supervision and assessment leads to really embed and finalise the work around supervision, so that we do not take away the responsibility of service at any point but we support with a level of principle, a level of understanding of how we all do our best work in this system. And so if there is finance available to support and help, how is that focused? How is that enabled to offer the best impact for the taxpayer, for the population, and for the development of advancing practice and professions? And there will be a session on credentials, because credentials are a tricky thing, but it's the credential that moves advanced practice from being the more generic piece into the areas that are going to drive that absolute transformational workforce piece. And Sally Gosling and the team have done some incredible work to really work, again, a bottom-up consultation to really understand how do we prioritize. We do not want 1,500 credentials, madness. We need key ring-fence pieces that need an element of oversight, direction, and assurance. And then it doesn't stop anybody else doing whatever else they want to do, they're welcome to. But where there are key areas of either high risk, high stakes, high transformation, or high volume, those are the areas where we have put the attention to be able to drive those fundamental moves of workforce transformation, and also to be able to achieve financial support through our programmes in NHS England to drive forwards that meaningful change and delivery. And again, it's all incredibly difficult, but it is work that we are really beginning to see take some shape. And again, the faculty leads have been incredible in working international teams to enable us to ensure that we are totally focused on what the reality of service is, rather than what our ivory tower might see and imagine. So Sally will run a session with Michael, with Julian and the team on credentials, and that will then really start to enable you to have that ongoing conversation, because this will be the year of moving to implementation. This will be the year of us really being able to think through, if we're going to be looking at credentials, let's make sure we've got the most intelligent, well-structured ways of delivering them. Let's make sure we've got them wound through into the programmes, and let's be really clear that there'll be some people who need to top them up also as sort of credentials on top of their advanced practice piece. And we really are holding the ring on advanced practice is the mainstay upon which we can hang our Lego blocks, as we said, all the way through, building on the assets of the system, always where people are doing this already. That's where we start. We're not reinventing new just for the fun of it. You all have business models that you need to deliver. We respect that entirely, but we need to work out how we take the risk of moving this forwards so that we can start to build really integrated, intelligent advanced practice programs that build the generation of workforce that service need, that I will need, my mum needs, as we move through our aging process. So credential specifications are being endorsed, it's adding huge amounts of work with API, and we are so indebted to API and Council Deans for Health for the consistent love and support and challenge you give us. So, so value it. Can't tell you what it means for us to be working in healthy partnership with you. But the credentials are going to be the mainstay for this year. The long-term plan will be very, very clear. This is where we are needing to build and ensure that we have got real attention to driving the new workforce models of the future. Again, playing to the strengths of what we have. The other bits of work that we are leading through, and I can take any questions you want on credentials, but there will be a specific session on that, because it needs to have proper attention paid to it. So we don't just go, it's too hard, it's doable, but it's going to require, I would suggest, some different conversations to play through. We may have had different aspects of work happening in different faculties across universities. There may be challenge, maybe history between different faculties and universities. Respect that entirely. This is a moment where, rather than having lots of different advanced practice programs across systems, please let's work together, again, with that shared purpose of meeting for the needs of the population. I appreciate that different organizational structures and different organizations make that very difficult sometimes. I get that. But whatever we can do to work multi-professionally together, but paying attention to the credentials, gives us a chance to build a collaborative future. And my biggest ask is, I've had to learn, I must not judge things I do not understand. And I think across a lot of the professions, advanced practice looks quite impenetrable to others from the outside when you see how advanced practice is manifested in those different professions. So if we're able to seek first to understand, not to judge, appreciate the difference and the different training pathways people have taken to get to that point, then there is huge value for us, I think, in really starting to, as organisations, think, how can we wrap around our advanced practice opportunities across the professions to really think differently about how the credentials could fit, And that's going to be tricky. But again, we stand in absolute partnership to see how we can help and support and understand, because what looks simple to us from the outside, I appreciate is so not simple on the inside. So, please don't let us oversimplify things that are difficult, but please work with us to enable us to support and help. The 4 pillars of practice, I say Joy and Annabella and Julian done a lot of work around the advanced practice aspects of the research work, with journal, etc. Fantastic. Education frameworks, we are working in the different professional groupings and at HEE with a overarching academic framework. For the HEE piece, it's very much around the practice-based educators, supervision, etc. But also the development and opportunity for future for people moving into academia to become academic educators, and to keep that flow through, because we want to make sure that we are breeding the next generation of educators across the spectrum as much as the next generation of clinicians, leaders and researchers. So there'll be quite a lot of work over the next year in that space, which again, after April, it'd be wonderful to come back and spend some time with you thinking that through from the advanced practice perspective, because I'm really hopeful we can get to a point where we've got better fluidity of movement across health and university sector, sorting out some of these recurrent issues around pay and challenge, work happening in that space. But also for me, it's about thinking, how do we cleverly use things like visiting lectureships, etc., to entice advanced practitioners into universities, enable the organizations to see it as a retention aspect for them of perhaps letting their staff move more creative. And some of you do this brilliantly. The question is, how can we do more of that to really liberate that cross-fertilization? And the Leadership Academy have been incredible in supporting us in so much of them opening their opportunities to colleagues, and wonderful webinars run by Southwest London and others to really start to think through how they can really help us to develop the leadership aspects of our colleagues, and particularly thinking towards consultant opportunity. The last key point for me is, you will remember at our conference, Navina has challenged us beautifully around diversity and around person-centered voice within all of this. And so again, all credit to Eloise and the team and the work that they have done with our patient voice representatives, or human being voice representatives, with our learners. There'll be a lot of work this year, again, trying to liberate the voice of our advanced practice trainees to really engage them in their learning experience and understanding. We have currently a piece of work ongoing, which is a real root and branch review of our diversity and inclusion work, to see how far short we fell, or how well we are doing, or where we sit. We have got a third party come in to do that for us, to really enable us to stop, think, redress where we are. And my commitment in the advanced practice space, as we discussed at conference, is that where we are in charge of structures, we will break down barriers that are reducing inclusion for colleagues across the piece. And where there are things that are happening that are outside of our control, we will work with colleagues to influence the change that we need to see. We've had a piece of work commissioned in the consultant practice space, looking at colleagues from different ethnic backgrounds and the challenge faced in getting to consultant posts, which is one of the most heartbreakingly awful pieces of work to read, brilliantly done, heartbreakingly awful to read, when you look at the impact of a lack of transparency and opportunity being gifted through people's careers, and the impact that has cumulatively on colleagues when they move towards consultant posts, particularly in the absence of openly recruited to environments. So again, work like that, absolutely sobering, absolutely fixes our mindset on the change needs to be now, the change needs to be different. So the work we're doing with colleagues is to really make sure that we are going to be running an informed, action-orientated piece of work. Sarge has been chairing that for us, and delighted that he has a new job, which is wonderful. We miss Sarge enormously, but Girish is going to come and work with us to help chair and lead that work. We need your help too, to make sure that we are absolutely clear about ensuring that our work is absolutely focused on equality of opportunity for all, which is, challenging, but it is absolutely fundamental to the work we must do. So future development, this is a year of credential implementation moving forwards. The portfolio will continue to run. There's a big evaluation in train being procured around the portfolio piece. Really looking towards how we continue to build the capability, the capacity of the centre to make sure that we can be as timely as possible in response, because I respect entirely that we are constrained in our capacity, and there is huge amounts of of opportunity and need. So a big piece of work as we move into our new organisation about being really clear about our operating model for the future, working very closely with the regulators to make sure that we are hand in glove as we move forwards into the NMC's review, and being really clear that as we move into merger, there will be some changes potentially to our personnel as we move forwards, keeping the ship steady so that the Centre of Advancing Practice is able to continue to drive the work, but a real commitment to continue to work with API, with Council for Health, with all of our professional bodies, partners and regulators to continue to drive this work with one shared purpose, which is to make sure that there is fair, equitable access to advancing practice careers for colleagues. I'm going to stop there, Kathy, because otherwise I could keep talking until midnight tonight and that would bore all of you. I'm happy to take any questions.
Thank you, Bev, as always. A clear and very articulate account of what's going on and the direction of travel for the future, which is very exciting, especially for the future workforce. Working together with HEE and the Council of Deans for Health to really face the future from an educational perspective, and working together to land everything that needs to be landed. So yes, it's a great opportunity. So there are hundreds of questions, so we won't get round all of them, unfortunately. But I'll pick up the first one. Are there any plans to harmonise the understanding and application of enhanced, advanced and consultant practice across all NHS institutions, as it appears there are different interpretations?
Yes, indeed. So this is, I would suggest to you, the biggest challenge, Achilles heel, whatever you call it, of all of the advanced practice work, is that I can say to Melanie, advanced practice, what do you think that means? I can say to Kathy, advanced practice, what do you think that means? I can talk to any number of people, and the number of people I speak to, I will get at least that number of different interpretations. And I think that is a real challenge for this work. You take that into enhanced practice space and I'll get at least double the number of interpretations about what it means, because people are learning. Now, again, I'll try and multitask as I go, but I will fail. But I will try and pop into the chat box, or maybe Eloise, if you could put into the chat box, my friend, for me, I'll be ever so grateful. The enhanced practice HE pages that have just gone live. Alison Leary has put into that paper an exquisitely brilliant table, which cuts to the chase, Kathy, I think it's fair to say, that says, this is from support workers, typical Alison, isn't it? She's nailed it. Support worker to consultant. This is what it looks like, and this is how it's different. And I have to say, I've been working in this for a long time. When Alison gave that to me, I just thought, oh yeah, that's it, Alison, that's perfect. So I think that will become probably our, what I'm looking for, the go-to place for that harmonisation of what does it mean. Now, the problem we have is that people also will often articulate the words along what they want it to mean, rather than what it does mean, if that makes sense, because whatever reason, that is how we are as humans. And so I think the issue for us is that we have worked so hard. Katie Cooper, one of our regional leads, has run a comms group within to make sure our language is consistent and to make sure that we're not confounding ourselves, let alone confusing anybody else. And that has been incredibly helpful in making sure we have consistency of phraseology, consistency of messaging. The enhanced practice work, I think when people start to see the nursing critical care enhanced practice work take shape and take the place of the critical care course, when they see therapeutic radiography with enhanced practice and therapeutic radiography, and people are beginning to really understand what does that mean, and they can see the impact that has on people driving their development into their band 6, band 7 roles, driving their specialization and driving the value of their more broader skill set too. I think that enhanced practice will settle down at that point. But the risk, Kathy, is that what happened with advanced practice at the beginning will happen with enhanced practice, where everybody gets shoehorned into a single space. And that is not, and that's why with Alison we've agreed that this is the enhanced bit is a professional program to make sure nursing sorts nursing, allied health will sort allied health, pharmacy will sort pharmacy, science will sort science, and so it goes on, because it is about growth of the profession. So what we'd hoped to do, Kathy, is we had hoped to do a piece of work that said, here's an enhanced, here is advanced, here is consultant. The challenge has been that getting those three things crafted to meet the needs of the systems has required them to each take their own shape. the next piece of work, once we've refreshed the framework, Kathy, will probably be to do something along that line to show the continuum. But I reckon it will base it on Alison's work, to be frank, because it says what it needs to say. So yes, at the moment they stand as 3 separate things, but very clear in their stratification. The big problem we have, Kathy, for employers is that when you look at NHS England's job evaluation profiles for jobs, they use the word advanced to mean the level 7 enhanced practice piece. And that is going to floor us at every turn. And I have done everything humanly possible to get that changed, and I cannot. And I can usually achieve most things, if only by terrier-like resilience. I can't get that changed, but that is a massive Achilles heel. So what James Pratt has done is keep drawing attention to it. Claire Sutherland, the work she does, keeps drawing attention to it. And our faculty leads have been incredibly clear with their teams that it is about the work our faculty leads do at regional level, for me, which is a transformational piece that moves theory into reality. And I think for me, it's the faculty leads that have been the utter transformation to us and being able to begin to influence those conversations.
Thank you. So there's another question here. Is there any discussions ongoing around a level 8 apprenticeship for the consultant role?
So we had, how many years ago? 2.5 years, no, before the pandemic, we had a really heady time when we thought we were going to be able to pull off a level 8 apprenticeship. There was the beginnings of a trailblazer. 1 or 2 universities really actively stood into the space, hugely excited. And our apprenticeship lead, Jane Hadfield, who is perhaps the most incredible human on the planet, felt that there was an opportunity for a clinical academic pathway and a consultant pathway, which would have been incredibly wonderful. Ministerial advice was at that point that having an apprenticeship route at level 8 was not an appropriate thing to pursue, which we understand totally and respect. So there will not be a level 8 apprenticeship opportunity. But what we will be doing, and what Rob and Kim are doing with colleagues across the piece, is understanding how can we craft a training pathway that we may need to resource in other ways, clearly, but that does give the orchestration of a career development opportunity that moves aspiring and existing consultants into that space, and working with NIHR and other colleagues to make sure across the pillars of practice. Leadership Academy have been incredibly brilliant in helping with that sort of big bow that wraps around the 4 pillars of consultancy, is how we can then create a training program which then can be focused in on the different specialties to drive opportunity to progress, Kathy, but it will not be by an apprenticeship, I'm afraid.
Another question: can the public check the directory to see the digital badge and know that people are ACPs?
So this is where Michael Guthrie has been so incredibly brilliant for us. So we have a really difficult piece of positioning around what HEE's statutory what we're allowed to do, basically, Kathy, and what we're not allowed to do. And our regulator is our regulator. And if you remember, we had to stop the directory activities that we were doing because with Michael joining us, very, very clear, that blurred our line between regulation and HEE's right to quality assure work. So we did not pursue the directory, which has been absolutely fine. The digital badge will be a personally held piece, which will be part, again, of your evidence of being the clinician that you are. Many employers will be looking to ask to have digital badges as part of their assurance of people's activity. CQC, interested in where we are around being able to evidence people's education and training. The public would not see it naturally. You could make it available to your patient if they chose to ask you. You'd have your digital phone in your wallet. You could show them quite happily. It might mean nothing to them, but it might be the assurance that they need. Our hope is that by working with the employer's role is to govern their workforce, to make sure their workforce are safe. My hope would be that patients would be secure in the fact that the employers are moving into the space with us. We work very closely with NHS employers. And the challenge with all of this work has been, it's taken so flippin' long, Kathy, to land some of these bits of work that we have to get them to a certain point before we can really engage with the employers. Otherwise, we set clinicians, university colleagues, managers up to fail because too much happens too fast and the world isn't ready for it. So we're not at the stage yet where there's any requirement for this to be a thing, but that potentially will happen in the future and be driven by CQC and by employers. And if you look at some of the work in primary care for first contact work, primary care and CQC have got, there's a statement that says we'll be looking to see digital badges in the future or the equivalent thereof to evidence that people are suitably trained to be allowed to operate at this level. So yeah, I think this will become an increasing thing in the future, Kathy, but there will be no directory where a patient can go and click on and check. If they want to check you out, they will check you in against your regulator, and your relationship as a Kathy Haig with your regulator is your responsibility as a registrant to make sure you're suitably qualified for the job you do. Our duty is to keep the responsibility with you as the registrant.
Thank you. Next question. Will there be further cohorts for the e-portfolio routes?
Yes, absolutely. And I think that I know the work that Julian, Annabella and Katie, the team are doing around developing the portfolio piece is making sure that we are continuously improving, holding the standards on the quality, making sure the employer is driving the person's ability to be on the program in the first place. So we've got some governance anchored into the employer, because it is tricky, as you can imagine, to get this landed in the right place. We have bid for funding for next year for the portfolio route. There will be a transition point when, because of course, at the moment, we're again building on the assets of what we have in the workforce already. There'll be probably from start to 5 years, people who are moving into this space who bring their transferable currency with them. From now to the future, we will see people coming through accredited programs who don't need the portfolio route, don't need the digital badge. So there will be a handover period where we then move to a new future, which is people who've all been trained through different routes. The challenge we have is for some of the professions, and in my allied health role, some of the professions I represent, there is no route for them to do meaningful advanced practice in their specialty. So for many of the professions, they are quite a way behind, not through any fault of their own, because we focused on the big ticket, big profile environments. If I was a prosthetist or an orthotist, I would look at you saying, well, I'll always need a portfolio because no one's ever going to bother about the 40 of us that we train every year. You know, what's out there for me? And that's our challenge, Kathy, is to make sure we don't leave people behind, but there will be a sweet spot where the portfolio will be much less of a thing, if that makes sense, and we will get into a new dawn. And then I hope it becomes business as usual. I hope some form of regulation steps in and we can all breathe out, and that becomes we then evolve from there, Kathy, she said, hopefully.
There's always the hopefully. So the next question is, will the new workforce strategy articulate how advanced level practice and those working in this space leads to transformation so that these clinicians are positioned in the right place to achieve their potential?
What a brilliant question. Probably not, I think, if I was being brutally honest with you, because it is a massive ask of a few pages of A4. So I don't think it's good. What we've tried to do is, and again, my fantastic regional colleagues, Linda Cross, for example, working absolutely deep into the learning disability autism space, trying to position the advanced practice opportunity as one of, and I'm very clear, one of the solutions available for workforce development and transformation. So I think it'll be more nuanced than there being a big section on, there'll be a section, I would imagine, on advanced and consultant practice. Clearly, it will be authored by many people and it will be edited by many people. So, you know, who knows where we end up exactly. But the advanced practice piece is in the underpinning service specifications that will sit behind each of the program areas. So, for example, women's health, huge piece of work ongoing around modernising women's health services around continence and pelvic health. The credential for pelvic health, front and centre in that work. That will be the currency of how we drive pelvic health services in the future. It might be a nurse, might be a midwife, it might be a physiotherapist, don't care who it is. Have you got the skills to be able to do that work using your professional brilliance alongside the core skills of pelvic health, which we're doing already? This just gives it currency and recognisability so that we can do mass scale transformation across the system. So it's absolutely in there, and that's where these the incredible regional leads are influencing, if that makes sense, what that future workforce looks like. And the reason I say one of many solutions, Kathy, is because this is everybody's answer to everything. And we all know, you know, with your students, is that it only works when there is good workforce planning, good support, a job at the end of it, a really well understood transformational programme. So what we do is we work with the NHS England programmes to make sure the transformation is happening within the service changes and the commissioning, because thinking of imaging, if we aren't changing imaging contracts to allow the radiographers to have the huge scope of practice opportunity that they could have if it's outsourced, advanced practice and outsourced radiography imaging services will not be able to exploit the full skill set of the profession, because the contract doesn't allow them to, because the contract is probably 10 years out of date of the development of the radiography profession. So there's some real lots and lots and lots of different bespoke challenges that we are unpicking as we go, Kathy.
Thanks. Is there any update on whether accreditation with the Centre for Advancing Practice will be a requirement for future regulation of advanced practice?
Don't know. And I'd be lying to you if I said I did. I don't even know that advanced practice will be regulated. So the NMC, as I say, are undertaking a really thoughtful and intelligent piece of work to think through this. They understand absolutely the importance of this. And what instruments they choose to utilise. And again, Michael Guthrie is the absolute expert in everything, but in this context, is that what instruments they choose to use in that space will be determined by what their consultation comes back with. Then HCPC, RPS, the Pharmaceutical Council, others will, I hope, again, stay in the same space. What we have done is the housekeeping that needs to be done to get to a point where regulation, we've sort of tried to fill the gap awaiting regulation. Colleagues from the NMC and all the other regulators have been cited on everything that we've been doing all the way through, and we have moved some of what we do to make sure that we are in a position that is genuinely useful to them. As they move towards understanding what regulation would look like, I have no doubt that they will build on the assets again of the system, and that will be the work of the centre and the work that the other 3 countries have done around advanced practice. So I would expect that they will be building upon, not starting again, because there will be no point with public money, with the challenges and the hard work you've all put in, starting from scratch. I can't say that, but if I were the NMC, I'd be looking to build on what has happened already, which is why the work being done around the overarching framework conversations is so important, because that then starts to move us all towards having a commonality that the regulator could then attach to. Anything to do with regulation, if Mark Radford was here now, he would say this is going to take years to craft. And what we don't want from regulation is this being pinned to the floor so tightly that what advanced practice looks like today will be the same as what advanced practice will look like in 10 years' time. Because believe me, it's going to look fun. When the new NMC standards kick in for nursing and the other professions are allowed to step into their space, we will motor with advanced practice, I have no doubt. I do not want a draconian pin to the floor that means that we cannot then keep advancing and evolving the work that we do. So, as I say, I would imagine that the NMC will continue to work as collegiately and constructively as they have with us to date, and we'll get to a point. But if it's going to take 2 to 3 years to get to that point, then the work of the centre and the accreditation piece remains absolutely front and centre, and will continue to be the mainstay upon which service governance has landed, and upon which digital badges and therefore service transformation and funding is attributed. So tragically, colleagues, it won't go away. Our job is to continuously improve it together to make sure that it is as proportionate and pragmatic as possible. And again, the work that Natalie and regional leads do is incredible in that space. So please keep talking to us.
Totally agree with the regional faculties. They've been amazing. Definitely made a huge difference, not only to HEIs, but to the students and to advanced practice, enhanced practice, consultant level practice. So a question from me now. Around HEIs and how HEE and the Council of Deans can support HEIs to move forwards in education and land credentials on behalf of the centre without upsetting business continuity.
Blimey. Sorry, save the best till last, Kathy Haig. I think if I'm being brutally frank with you, my thing is we would do it together in partnership. I mean, I know that you and Katrina McLean is our secret weapon in all of this. The woman is absolutely incredible. But I think the issue for me is that we appreciate the credentials are tricky. We appreciate that the system needs them, and we appreciate that we are learning. So I think in those 3 bits of spirit, the issue for me is I want us to come together. And again, this is the work that we are doing in harmony to say, how do we, and the challenge is, Kathy, the reason that I think this is so tricky is that because you all work so differently, and you have different faculties and different specialties and different everythings, that and again, forgive me, this is probably an oversimplified external perspective, but you know that I don't assume that I know, this is what I see, is that I think it's going to be a bespoke conversation with each of the HEIs to say, let's look at where you are, let's look at what you do. And I don't mean us in a paternalistic way with you, I mean a conversation as adults together to think, what on earth are we going to do here? Is that I would want to sit down with the university to say, let's look at across all of your university, because you might have the most incredible neurorehabilitation MSc program, which is not badged advanced practice, but is by every other mechanism, the clinical aspects at the very least of the advanced practice piece, is how can we look to say, actually, you may not work together very closely, or you may work very closely together. You might love each other or hate each other. I don't know what it is, but what have you got in your university? What could you look at with what we've got credentials? And you can see what's in the pipeline. You can see where we are and talking with us. Let's work out how you could position yourself, and as an organization and a business where you choose to position yourself. And again, I would be wanting to have system conversations to say, and national conversations. I do not want 17 universities running the pelvic health credential. There is no point. I need one or two, and we already have one or two brilliant universities active in that space, very multi-professional, very established. They need to be the people that, and I use it as an example, they need to be the ones who are driving it. Let's get over ourselves. There's enough work for everybody. They crack on. There'll be other universities who do the most exquisitely brilliant, I don't know, pediatric work, for example, but it might be pediatric rehabilitation, not pediatric nursing. So again, when the pediatric credential lands, there are different, you can interpret the credential differently. You might have 2 universities in the country who do pediatric rehab, but you might have one university in every region who does pediatric acute facing care. I'm making it up, Kathy, but we need to have those conversations. So several things will happen next. We are moving to implementation. We wanted to make sure that it was informed. So Sally's been working with numerous stakeholders to make sure we're informed. We've got a meeting on the 18th where we're going to start to distill that down, and then she'll come back out again for more conversation into an implementation plan. We are going to have to, as you know, we commission so much of the work, and we have to have transparent, clear, open commissioning. Jan, who's my business manager, is currently working through where we've got contracts coming to end, how we're going to then commission for the future in a way that enables innovation, Kathy, but doesn't kibosh what we've worked so hard to create. So Katrina McLean again is the voice in that space. So Katrina is your secret weapon in helping keep us honest and in the right place. So we need to position that procurement in a way that enables us to liberate the advanced practice opportunity for you all, but also liberate the opportunity around credentials. And we're just in the process with our procurement team of understanding, are they clearly part of it is the same, but there are also the opportunity around the top-up credential piece. And some credentials may only ever be effectively top-up for people who've done other advanced practice. So public health, for example, that may only ever be a top-up because we need to drive a fundamental change in population health understanding. Don't know yet. We need to start somewhere and build together. So that piece of work will start to help us. But again, if I were in a university at the moment, I'd be nervous of the business opportunity. Say, for example, the rehab credential. I'd look around saying, well, I don't want to be the first to blink, or maybe I do want to be the first to blink because I can see a huge opportunity here. It will go on the basis of your business challenges and opportunities and existing expertise. So regional leads are already having conversations with universities. But what I would love, if I ruled the world, Kathy, I would be saying, Annabella, your regional lead, will come and sit with you, work with you. She would have you, she'd have your allied health program postgraduate leads, your science postgraduate leads, and your pharmacy postgraduate leads, whoever else is there, psychology, whatever, bring all together and say, right then, let's look at what we've got across the whole university. Let's look at the business strategy of Cumbria, where you want to be, where you've got energy, where you haven't, where you've got staff, where you haven't, what you want to do. And let's look at what we might want to put on the table, and then hope that we could do the same across all the other universities in your patch. And then we'd all come together, and I know I'm talking complete baloney here, but we'd all come together as a group, and we'd say, right then, enough work for all of us. We need one mental health program in the region. Who's going to do it? Who's best poised to do it? Right, you crack on and do that. We're going to do the acute 3 credentials woven into one, and people are going to follow their own pathway within them. Fred's going to do pediatrics over here, but They're going to do neonates and pediatric acute and rehab because they've got a really brilliant multi-professional faculty, and they're going to do. I would want to see really clever regional orchestration, Kathy, of who does what. That would then, and please don't get scared, anybody. This is Kathy did ask me the question, and this is what if I ruled the world, I would want. That way, I think we get to a place where we have fair allocation of activity, business slice. It requires a different way of working for organisations who are trained to be in competition with each other. I respect that. But the NHS, if we're going to survive and drive, I need a different level of working across everybody, which is not about competition, but about total collaboration. I need us to make sure that where we've got different faculties that may have history or may have different ways of operating, that it's not about, the pesky, bossy physios thinking that they're in charge and telling everybody else what to do. It's about everybody coming together saying, we appreciate advanced level practice. We'll look different in the different areas. I'm curious what it looks like in nursing. I'm curious what it looks like in radiography, whatever. Now let's see which bits bind us together and which bits sit separately. And let's see how over time we craft things. And again, I know I'm sounding totally naive when you think about all the process you have to go through to get your programs accredited. Please don't, internally, please don't think I don't respect that. I do. But I'm tired of tweaking, I think, Kathy. There's a bit of me that would like to see us have a plan towards tweak, but then a parallel revolution. Because let's face it, I'm only talking to myself because I'm old and I can see retirement in the distance. All of this work I'm going to need. I'm a carer for my mother. I need all of this work for my mother now. Healthcare is crumbling around our ears at the moment. If we were able to get to a point of a clever positioning now and a longer term parallel revolution that we all agreed to, that met the requirements of your business, met the requirement of the population, sensible, clever. We do it for patients all the time. We come together as a multi-professional team to solve with people problems that feel intractable. We can do this here. The challenge just is how we do it, Kathy, and have the time, to be brutally frank with you, to reinvent and to think. But we would like to try and create that environment where we could do that together, because flipping it, we're going to need it.
I completely agree with you. I think we are going to need it. And Louise has just made a comment that the Midlands HIACP group working together to review those core area specialities and collate a database of speciality for credential focus going forward. So an excellent example of collaborative business planning to ensure viability of ACP delivery going forwards. So if that can be replicated throughout the whole of the 7 regions, that would just be amazing. And doing that in collaboration with HEE and the HEIs would be the answer.
Perfect. So Sally is our person with Katrina. We will talk about this on the 18th, Kathy, and then if it's okay, come back out with a proposal around that. Again, I don't mean a proposal, I mean an idea of how we might do things that we can kick about together and find a way of. This is not here to confound or to pull the rug out from our valued partners at all. It's simply about saying, actually, our patients need this level of specificity. How on earth can we support each other to pull it off?
Absolutely, I totally agree. Well, we've come to 2 minutes to 10 past. Doesn't time fly? So can I just take this opportunity, Bev, again, to thank you so much for giving up your valuable time this morning and coming to talk to everybody. It's great to hear you. It's great to hear the message again. And I can see that the future is rosy and bright. However, challenged.
Yeah, absolutely.
But I think working together, we can achieve anything.
Yeah.
So thank you very much, Bev, for being here. And for the rest of you, we now have a 5-minute break. So if you want to go and get yourselves a cup of tea or coffee, and in the chat, Felix is going to put the Slido code or the QR code. Oh, 11:15 back, please. And then we'll get some questions going. Okay, so we shall see you all shortly. Yeah.
So if you want to start when you're ready. So welcome back, everybody. My name is Melanie Clarkson. I'm a senior lecturer in advanced clinical practice in radiotherapy and oncology. For those who don't know me, I work at Sheffield Hallam University. I'm going to be helping Kathy this afternoon with this interactive, I'm saying this afternoon, this morning still, with this interactive part of the webinar. On your screen, there is a QR code for you to be able to join Slido. This is where we're going to gather some information from you in this open session around the challenges of advanced practice for HEIs, and also then prioritise those challenges and concerns, and then try and look at some solutions collectively. So we will be asking you to contribute through Slido, but also to pop your hand up or to add any comments into the chat as well. So our first question is to ask all of you what you think the biggest challenges are for advanced practice for HEIs, and obviously some of you have got cracking with that already. So we'll just give you a few minutes just to add some comments into there. Lots of comments coming in there. Kathy, can you see all of them, or just the ones that are coming up at the top? Oh, thanks, Felix.
Yeah, I was just going to say I could only see the ones that were coming up at the top.
So
Yes,
if you can see, there are some categories appearing, but
Brilliant.
let me know if you want me to scroll down and to stop, basically, also the answer process.
So we felt this was a really important question to ask you all, because we can assume what the challenges are, but I think it's important to highlight some of the specific, we can assume that might be an issue, but actually it might not be an issue. And really about with the next question is about prioritizing what we think are the ones that we need to work at the most. Staffing is obviously coming up a lot, isn't it, Kathy?
Oh, yes.
Which I think we did anticipate. So that clinical academic workforce is really challenging, and it is challenging to attract those people to work into academia as well, because of, and somebody's just literally read my mind and popped up the word banding, and that can be a challenge to be able to attract staff, as a university. How do we attract people to be able to pay that salary? Exactly that, staff and faculty and parity of salary with NHS and HEIs. Is really sort of one of the key things of how can we develop that, and hopefully that clinical academic framework that Bev mentioned might be something that can be brought into that as well. Obviously, staffing just isn't one area either. Somebody's mentioned there around clinical capacity, and actually how do we get clinical staff out of service? The reason that we're developing advanced practice in the workforce is because when we need them. How do we therefore then free them up to be able to come in to HEIs to help with education? Yes, it's the educational pillar, but actually how do we manage to free up that amount of time? Have you spotted any other ones, Kathy?
Yeah, courses. Increasing demands on courses, niche topics, breadth of courses across the AHP professions, working with employers to co-produce course content, trying to meet many specialist needs with one generic course, number of trainees on courses and being unable to cap. Do you want to just go down a little bit, Felix, please, if there's any more? transformation pathways for the new graduates once they've completed the programmes. And then again, staffing and drawing on a small pool to recruit new staff, and HEIs do need to see the business benefit of pushing ACP activity. There's quite a few around availability of paediatric courses.
Mhm.
Can you go down, please, Felix? Staffing, again, with the increase in student numbers on other courses, particularly nursing, we are drawing from a smaller pool to recruit new staff, and HEIs need to see that business benefit. Funding, that's an issue. Do you want to pop those up? Time for HEIs to plan any new offer, viability and funding information required before we start. And that's what I was saying with Bev before about, you know, universities can be responsive, but we do have internal quality monitoring that we have to go through. And of course, nobody's going to put a new programme together or credentials together if we haven't got definite numbers. And whether that's going to be recurring numbers or whether that's just going to be a single cohort, is that financially viable for, you know, for most organisations? There's one just there about, will apprenticeships be the main way of funding? Some of the faculties are pushing the apprentice programmes, quite rightly, because obviously the employers have got that funding available to be able to send people on various courses. But you know, that's only a finite pocket of money, isn't it, across all organisations? And if we're looking at this from healthcare support workers right through to ACP, you know, how much is there going to be left to keep apprentices going?
I think there's also probably the apprenticeship banding as well, you know, does that, you know, for those programs that are completing apprenticeships, you know, does the funding, because we are a business, you know, how does that funding spread out across what you're delivering because of the support of the web-based learning coach and those types of things that are integrated into the apprenticeship as well. So I think this is a really great opportunity for us to be able to collate all of this information. We haven't got a magic wand today, but what we can do is collate all of this, and the Council of Deans and HE will have this information to see what the issues are out in HEI land, and also for us to consider, you know, the priorities of what we need to cover. So there's a few more people typing, but as we move on, so the next question that we have is that, as you can see, we've sort of collated those topic ideas, is for you to rank them into order of priorities. So what is it that, you know, for you in your working environment, what is it that's a priority for you to be able to drive forward advanced practice education? Probably a really tricky one to try and rank. Oh no. Oh. Too soon.
It's moving around, isn't it?
There are quite a few challenges that I've listed, so I might be a bit of moving around.
No, that's fine. That's fine. So I guess the biggest one that we're seeing here is around staffing and supervision capacity, and then the others are kind of evening out a little.
Is there anybody that's participating that would like to try and answer any of these challenges? If you would like to speak, if you just press the raise your hand function.
So I see Julian Barrett is raising his hand. I'll allow him to talk.
Right, Julian.
Hello there, can you hear me?
Yes, we can.
Yeah, fabulous. Thank you, Kathy. Yes, there's really interesting discussions here. So I'm really interested in this issue related to staffing for advanced practice programs, because it's absolutely essential. We're trying to put a large number of people through training to become advanced practitioners. So it's absolutely vital that we have a sufficient amount of colleagues working in academic roles in order those people to be trained. And I think it's essential that we think about how those people are employed in completely different ways to how we've conceptualized them currently, and particularly when we think of the current employment practices where someone might often be working in a full-time role within their university, and so that doesn't allow them to do any clinical work. So I think it's really important that we enable people to work in clinical academic roles where they can maintain their clinical experience and the credibility that comes from being able to maintain that clinical experience, but to combine that with their academic work within the university in relation to teaching, learning, and research. So we need to think about new employment practices in relation to that. And we also need to think about rates of pay for people in those roles and ensuring that their rates of remuneration are commensurate with the work they would get in relation to their clinical activities. And we can look across to our medical colleagues, because we know that many of our medical colleagues working in academia, they have those ways of working to enable them to work in those clinical academic roles with commensurate rates of pay as well. So I feel there is some learning we can gain from that model. So that's certainly something I would like the centre to be working on this year, to think about new ways of enabling clinical academic staffing and workforce development. And we'd like to work with key colleagues such as API, the Council of Deans of Health, and colleagues across universities to enable that to happen. Thank you.
Thanks, Julian. I totally agree. And again, you know, HEIs are constrained by the national pay framework that's very similar to Agenda for Change. You know, and all senior lecturers, irrespective of where you are lecturing, get paid the same salary. So there is difficulty within the HEI systems to allow for additional payments, you know, because if one group of staff get it, you'll get another group of staff saying, oh, well, we need it as well, because. So yes, I totally agree with you. There needs to be a national conversation. Annie.
Yes, I mean, I would, sorry, Annie Topping, University of Birmingham. We run an ACP program, but I also have an interest in clinical academics as well as ACP. The issue of salary is really quite challenging, because I would say that we're seeing increasing, you know, poaching backed practice, the need to create flexible roles, the need in higher education to pay market supplements. And one of the key issues is the different places people are, and it's very similar in clinical academic careers, is someone might, in that context, someone might have a PhD, but they are a very relatively junior member of clinical staff, or their experience is relatively junior. And how do you match the different parts of their salary? And similarly, the other way round. Because, in fact, advanced practitioners, once qualified and leading services, who may be banded at all sorts of level, are equivalent to professors in most higher education institutions, but they are not necessarily delivering on the attributes of a professorial post. So it becomes really challenging. Now, I'm not saying you can't do it, because we are managing to do it, But what it does mean is these programs cost far more than potentially a pre-registration program. And when one thinks of volume, one has to have security in contracting. So it's not merely sorting out a piece around staffing and banding, it's also giving HEI security on how long they will be running something, so they know that it's where they can do the investment. So I think it is highly complex, exactly the same as clinical academic careers, but it's not something that we shouldn't tackle, because if we're really going to develop this amazing workforce in the ways we need to do, we've got to tackle it. So I think it's a must, as opposed to, but I think it is a very challenging space, and I don't think it's necessarily an easy fix.
Totally agree with you, and I do remember at the Council of Deans conference in 2019, Brian Webster Henderson bringing up the issues of salary then, and now we're 2022 and the marketplace seems to have changed dramatically, and not for the better. So yes, I think that's a great space in which the Council of Deans, the HEIs and HEE can all work together, and of course service, because trying to get service to agree to lecturer practitioner posts, you know, or a clinical academic, not everybody is ready for that at the moment. So I don't think, like you say, Annie, it's not an easy issue. But as Bev always says, you know, if you can tackle an issue head on and start conversations around them, who knows where we'll get to, but that doesn't help us in the short term.
No, and there already are examples and workarounds and ways of doing it that we could use.
Yeah, that would be fantastic to use.
I think as well as a comment in the chat from Jan, to note that obviously the academic contracts do differ across the 4 nations, and actually collectively perhaps that's an opportunity to work again across the 4 nations to look at how things are done differently and how we can benefit from each other as well. So as we move down, sorry,
Sadie's just made a really good comment about it isn't an easy issue, but it does need to be tackled.
Yeah, absolutely. So I guess that kind of encompasses that first top 3, doesn't it? Around, I'm assuming when we've got clinical capacity, that means that being able to release people and to be able to support education, and obviously the issues in recruiting staff. Then we've got funding, and the differences in professions. I think that is a massive challenge. You know, we've got a lot of programs where they've got those, you know, those level of skills, but do they need the specifics of their professional background? We've got a lot of comments there around regulation. I think that's going to be quite a hot topic as we move through as well. Funding needs to increase, as a comment from Claire, to increase the cost of courses, absolutely. And that alludes back to, you know, if we're pushing for apprentices, is that apprenticeship banding of funding appropriate, or is that something else that perhaps needs to be addressed? And obviously we've got the apprenticeship route suggested down here. Engaging with trusts, I guess that's very different depending on people's working experience. And I guess surprisingly student numbers are at the bottom. I kind of expected that to be a little bit higher up, Kathy. I don't know whether you...
Yeah, I would have thought it would be higher up.
Yeah. Is there anybody else that wants to sort of pass any comment around some of the things that come up before we try and solve these issues?
Katie Sharp.
Sorry, I forgot to put my hand down, but essentially what I was saying, and I put it in the group chat, was that I am, well, it sounds like I'm a rarity here and I feel like a bit of a imposter. I'm a visiting lecturer at University of Winchester and also at RChem credentialed ACP, working in a busy emergency department. And I feel it's about recognising that portfolio career can breed sustainability for both clinical and academic work. So I think it's about encouraging that aspect of things when we go out to try and encourage people in to the academic roles and senior lecturing posts. Does that make sense?
Absolutely.
Yeah.
Yes, it does. And it goes back to that clinical academic workforce and the needs, you know, the needs to be able to develop that. But like Annie said, it's, you know, it's not an easy topic, but it does need to be explored very, very quickly.
Yeah, we've just got a few more comments just to agree. Support around the development of clinical staff within HEI and assurances of programme. Significance of allowing development and growth. Absolutely really important. Doctors often work across both roles. And I guess it's just about breaking those boundaries, isn't it? You know, another boundary that kind of crops up that we're trying to overcome. Are we happy, Kathy, to move on to the next and the final question?
Yes.
Yeah.
I think so.
I think this is one that probably will promote quite a lot of discussion. But if there was a sort of solution within reason, I know we want to have a magic wand, but how do we look at working with Health Education England and the Council of Deans for Health to look at some resolutions for these challenges, and what support do we need so that, you know, that we can try and work together to solve some of these issues to allow us to provide the best advanced practice education that we can.
Yes, I agree with that. More stakeholder engagement events.
Bob, it's good to know it's been beneficial as well, if people want
Absolutely.
more of them. Yes, across the 4 nations, I think, is key, isn't it?
Yes.
Absolutely, Adele's just put in the chat about the last 12 months have been transformational for ACP, and it would be great to build on the momentum. It's certainly been moving at pace.
Yes.
So it's important that we keep that momentum so that we can challenge some of these barriers then, I think, as a collective rather than one university trying to tackle. Absolutely, collaboration to ensure consistency of practice. That's a good question about the funding cycle, the 1-year funding cycle. That can be something. I know we have HE colleagues on the call. They might be able to take that forward as the merger exists.
Yes, I agree with that. Pushing the security of contracting.
Yeah. Yeah, I think that's the part of HEIs to work collaboratively. I think from previous discussions I know that I've had in meetings, it doesn't tend to be us collectively that are opposed to that collaboration. It's it's the culture higher up in senior leadership of universities, and actually that's another cultural barrier that we need to break down, to say that, you know, collaboration can happen. You know, we do that in APPE with the endpoint assessment for the apprenticeships. So actually, you know, how do we open that out further and to be able to collaborate further?
Now, I've just been unmuted, Kathy and Mel, so I could speak. So I could speak for a minute about the funding, and I entirely agree in relation to the funding. It's difficult. You know, before I was working at Health Education England, I was working at universities, so I know what it's like to be receiving details of funding. And sometimes it feels at a relatively short notice. It is very complex across the 7 regions, looking at the funding that Health Education England provides. And it's not just advanced practice that it's providing funding for. So there's a huge amount of funding that it provides for different programs and activities. So it's a complex activity. But we have been looking at trying to rationalise the funding that's offered for advanced practice across the 7 regions, both in terms of the funding that's provided in relation to tuition fees, and also the funding that's provided in relation to supervision and assessment. And you know, we certainly understand that the need to try and rationalise those funded cycles so that we can get the information out sooner to provider organisations and universities. So we're certainly aware of the need for doing that. We want to come to a more consensus model across the 7 regions as to how that funding operates, which would encompass both timescales and also thinking about the rates of remuneration that are included in that funding. So it's really important to think about. And we were touching on earlier about apprenticeships as well. So we're very much planning for a combined model for preparing advanced practitioners, where there's that space for trainees being funded via apprenticeships, but also recognising that apprenticeships can't provide all of the funding for advanced practice education and training. So that also tells us there's a space for commissioning or procurement processes for advanced practice education and training. So they need to exist together alongside each other. So we have apprenticeship funding and both commission funding being provided by Health Education England, or as we moved into the new merged organisation together with NHSC, and we'll have a discrete directorate within that organisation. Thank you.
Thanks, Julian. You would hope that going forward, any government would look further than 1 year ahead.
I know.
We're not getting into a political argument.
I know it's difficult in relation to those funding
Absolutely.
cycles, but it's a bigger picture beyond us, that
Yes.
component.
Yeah. Unfortunately, we can't move that elephant.
I guess it's the way of working to get, you know, there's things that we can't change, but it's actually how collectively do we manage that challenge.
Yes.
And people will have found different solutions or different ways that might work for them, that you might be able to try, or that might sort of half work for people. It's about opening that conversation to say, you know, we tried this, and actually I did this, and that seemed to work quite well.
Indeed.
I like that one about ensuring APPE is involved in initiatives going forward.
I know. I was about to say that
we've got that many pies and that many fingers. But it's great to be able to work together. And I think from an APPE perspective, I think there could be more of that in terms of bringing HEIs together for events such as this. Even if that's on a regional basis, where the conversations can start to take place about whether it's right for every university to be producing everything, or how we're going to share out the workload between universities in a specific region. Go on, sorry.
Sorry, I just was going to say, I know what we have tried. There's been a diagnostic radiography sort of speciality meeting where all of the HEIs who deliver advanced practice education came together to discuss some of the barriers and the issues, and that worked really well. So whether that's something that can happen in other professional groups that could be supported, you know, to just look at some of the, because there's going to be professional issues, isn't there, as well, across HEI programs, and not just the universities themselves. There's going to be other things that can be discussed. So it's just that collective coming together, isn't it?
Absolutely. And Sadie's made a comment about it is really important that API is involved, as they represent our collective voice. And I think that's very true. I know we push constantly to ensure that, you know, that the voices of HEIs are heard. And we do provide a critical challenge to other organisations. However, that's always with kindness.
Yeah.
Because at the end of the day, we all want the same. It's how we get there. And really importantly, it is about the 4 countries. We can't, you know, I know we have to work in isolation because that's the way it is. However, there is nothing to stop the 4 countries from working together to ensure that there is transferability of qualification around all 4 of them.
Yeah, absolutely. And he's mentioned as well about tender processing for credentials, and that probably also links in with the supported e-portfolio route comment about, actually, as the digital badge is being launched, then the requirement for that is going to increase, and actually do we have that provision in HEIs? So I guess, Julian, I don't know whether you're still unmuted, but is there an opportunity for HEIs who have not been involved in the portfolio process to become involved? Will they be able to tender again? And again, with the credentials, is that, I know we're going to have a credential webinar next time, which we might be able to answer that question more, but just opportunities for HEIs to come on board, I guess. I'm not sure if Julian's still unmuted or if he knows the answer to that.
No, he might have just disappeared for a minute.
Sorry, I had to drop out for a second. Sorry, I missed that. Sorry, what did you? Sorry.
We were just we were talking about tendering for the credentials, but it kind of.
Just right. Oh, yes. Okay. Yes. We've been thinking. And go on, Mel. Sorry. And what else were you going to say?
It just linked in with a comment that about the capacity of current HEIs for the e-portfolio. Now that the digital badge is being launched, we're anticipating an increase in people wanting to go down that route. And is there an opportunity for HEIs who perhaps aren't involved to be tendered to increase that capacity?
Yes, we'd like to get more universities involved in providing the e-portfolio supported route. Yes, certainly. Obviously, we've got the 3 cohorts. We've got the next 2 that will be starting soon in the springtime, but we're also making some plans for looking at a 4th and onward cohort. So we need to get more universities involved in providing that, because we anticipate there will be an increased demand, because we know there's many existing experienced advanced practitioners who want to be able to gain access to the advanced digital badge. So we're certainly thinking about doing that. And we've also now linked the funding for the e-portfolio supported route into our annual funding cycle for advanced practice education, which then puts it on a more sustainable footing rather than having to ask for funding separately for it each year. So that would get integrated into our normal commissioning cycles. And yes, we'll look at including more education providers. And there's also potential scope for other components of the systems to get involved in the portfolio supported route. So, for example, such as doing work with professional bodies, such as we're going to be starting to do soon with the RPS in relation to recognising pharmacists working in advanced practice roles. In relation to credentials, yes, we're all conscious of the need to look carefully at the funding for credentials and how we do that, being mindful that we can't have these specialist credentials being offered everywhere. And we're going to need to concentrate activities in relation to those across the regions and also within regions. So we're thinking carefully about how we might make that funding for credentials available. And as Bev noted earlier, we're going to be having some detailed discussions a bit later this month in looking at that further. So it's a key issue that we need to think about in order to ensure that the availability of the credentials is funded on a sustainable basis, which is suitable also to the market priorities of universities and makes it affordable for them to provide.
Thanks, Julian. There's so much coming in on this chat. I'm sure there's huge things that that we've missed. There's comments about subcontracting on DAs, really important thing to look at as well. The 4-country approach is definitely something that is coming up, especially with potential for regulation. Bit of a plea there about not changing the pillars in Wales. From the English perspective, from meetings I've been in, I think the pillars will remain primarily the same, like Bev has mentioned. It's the context around it that needs the currency updating. I'm conscious of time, that we had until 10 to for this. Is there anything that's burning and that you've seen in there, Kathy, that you think needs to be brought up before we bring the webinar to a close?
I think taking back all of the feedback that we've had through this Slido and taking it to API and looking at ways in which API can support HEIs or support the development of further conversations, be that on a national basis, and the Council of Deans for Health, Annie, and, you know, either nationally or regionally, so that we can start to explore some of these issues and look ways through, you know, so that we're all achieving what we need to achieve and delivering what we need to deliver. But working, like you said, together. And I have to say that when many years ago, when I first joined API, it was quite tight in terms of discussing what each university did. And it's over the years that has become more and more open and transparent. And we can sit there and we can look at issues we've got within, or, you know, within our area of practice or somebody else's. And we, you know, we support each other and look for ways in which to, in which everybody can develop. And I think that needs to continue. So I think, you know, from a national perspective, there could be more of these. Just making them a chat, you know, in the similar way that we've done today, to have those conversations, you know, come in, stick it in. This is my problem. How can the collective help us work through these issues?
I guess it's like a support network type of,
yes,
for HEIs. You know, we often talk about that sort of clinical supervision support in clinical practice. Actually, what do we have as HEIs to be able to say, you know, I have this issue, who do I need to speak to? It's often fortuitous that you know somebody, or you know somebody who knows somebody, but if there's an opportunity like this to be able to say, this is my sticking point, is it the same as everybody else?
I agree with what you've just said, Annie, about priority setting and needs some thinking through, and identifying those that can push and resolve agendas, because sometimes it's not within our gift to be able to do that, and who does need to drive particular issues so that we can constantly improve and achieve consensus. And I'd like to see that done throughout the 4 countries. It isn't just about one. Yes, HEE is Health Education England, but we've got Health Education Wales and Scotland and Northern Ireland. And yeah, I totally agree that we should be working together.
We're at 5:02 there, Kathy, so is that an appropriate time for us to?
I think it is. I do think it is. So I'd like to thank everybody that's come this morning and given you time. I've thoroughly enjoyed it, and I'm sure you have as well. There is a live feedback poll that is going to appear on your screen in a moment. If you could give us some feedback, please, we would be really, really grateful. And I would like to remind you that this is the first of 3 events. The next event is on the 30th of January, and that's 10 till 11:30. And that's around the implementation of credentials and reaccreditation. And then on the 6th of March, from 10 till 11:30, there is the final webinar in this series around sharing advanced practice. So, like I say, thank you very much for coming. Thank you to our speakers, Bev. Thank you to Felix and Nadia that have been in the background directing us. Thank you, Annie. Thank you, Mel. And anybody else that I've missed. And Beverley, of course. And we hope to get this recording done and get it out to you soon. So thank you and see you soon. Bye-bye.